Good morning. Thank you all for joining. We'll let everybody continue to, Julia will continue to let everybody in. We are live streaming. No, I'm disappointed. Usually this time of the year, I have at least somebody who has decorations behind them. And I don't see one, sparkly tree, just something that's, but I do like your bright yellow, Marcy. Like my eye is drawn to your square. Love it.
Melissa, this is Heather. I'm showing you my tree. It's just not in my.
Oh, I like it. And I think Marcy's taken us through so that we can also enjoy. Oh, see, love it.
You
All
needed
right.
that, Melissa.
We
Melissa,
did.
Melissa, this is Emily Barnes. I'll turn mine around and hold on. I got to unblur and find it.
See, I think it's just fun to have a little bit of cheer.
Where is yours?
Mine's in the corner.
There we go.
It is bright and oh, I love it, Emily. And this is our first year that we actually embarked on a real tree. So the house smells so good. Though I will be picking up pine needles, I think probably until February. They are everywhere. And now they're on the dog randomly. We have a Sheltie and she's just collecting, she just collects anything. Well, again, welcome and thank you guys all for joining. Very excited to have everybody. I know when we paused on the systems improvement team over this next year, it's really to allow the department to do all of the work that you guys have provided input on. And we have been nonstop. I really will say our department has been very much full-fledged moving forward into our regulation review. And so what we really wanted to keep our promise and have an opportunity to elicit feedback from the systems improvement team on our school age regulations. We have been meeting. We had a summit just in September. It seems like a lifetime ago, where we invited all of our drop-in programs and our school age programs to participate in person. And we invited some of our licensing specialists, otherwise known as our surveyors, to participate and really had a meaningful full day conversation. And for those who were not able to be in person, we had a Zoom option, which, by the way, I met some fabulous school age programs. So some really amazing things that are happening at the local level. Like if anybody, I wish I was young enough to be enrolled at the school age program in Manhattan. It's at the zoo. And so she had a different lens when we were talking about access to animals and what that looks like. And so I'm like, oh, I want to be young again and go back to their school age program and just be able to go to the zoo all day. So what we are going to share with you today are a high overview of the drafts based off of stakeholder feedback. There will be an opportunity at the end for you guys to continue to provide feedback, but really this is going to be a high overview. And before we segue into that, I wanted to take a minute and because we are a tight-knit group and really have an opportunity. I don't know if anybody, I'm always looking at everybody's name and, if they put where they're, what agency they represent, because Bethany is like the star. She gets the star for today. She has her name and DCF all in one full swoop. So appreciate that. But wanted to take an opportunity to congratulate Emily Barnes in her new role as she's joining our systems improvement team. Emily has joined as a provider, as a CCPC representative, and now she is in the role of serving with the Kansas Action for Children. So I'll give Emily like a that virtual round of applause and thank her for her ongoing participation and definitely in her new lens, because it is a different lens moving forward, and appreciate Emily continuing to work with us. So all of that being said, I'm going to pass it on to Lucas Ryan. Lucas is with our A&P, Administration and Policy section within KDHE. You will see we are a small group today because the work never stops. We are going to be engaging you guys looking at our out of school time regulations. And we have the other half of our group who is meeting to go over any critiques on our regulations that are currently at the Attorney General's office. So we are conquering and dividing today because we want to keep moving these regulations forward in a very positive manner. And so we wanted to make sure that we were just, able to do it all in one day. But that being said, I will go ahead and pass this over to Lucas.
Awesome. Hello, everybody. So yeah, this overview is really focused on the out of school time regulations, which was formerly the school age program. We can go ahead and advance the slide. This has been the main team working on it. I'm sure this is kind of a familiar slide to most of you from the last couple times we've come to present. I think Jarvis is on as well. So I'll go ahead and give just brief introduction. I'm Lucas. I've been with the department for about 6 months now. I serve more of a support role in kind of research and rhetoric for making sure that the language is drafted correctly, but all of the content itself has come mostly from the program. I'll go ahead and give Jarvis a moment to introduce himself if you'd like to.
Good morning, everybody. I think I've met or seen most of you before. Happy to have everybody on and help us move forward with the project we've got going on. Thanks, Lucas.
And then we've already heard from Melissa, and I think everybody knows her. So we'll just go ahead and move on to the next slide. So first, the overall process for the regulation review has been really a lot of these regulations that haven't been touched in many, many years. And so we're looking at ways that we can continue to reduce the predictable risk of harm to children in childcare settings, and really set that foundational level of quality for the protection of the health, safety, and well-being of children in care. But at the same time, we're working to reduce the barriers. Sorry, my dog is outside in the hallway, so if you hear her barking, that's because she wants in. But we're really looking at trying to reduce the barriers for programs so they can continue to thrive and expand, to see new programs open up while maintaining that health and safety. And so that's really been our guiding light through this whole process as we review these regulations, is how can we reduce barriers while still keeping children safe? We can move on to the next slide. So we've done a lot with this regulation review. The most impactful changes that we've done so far have been restructuring the licensing and application process, and we redid quite a few of the regulations here in kind of structure. We're clarifying the building requirements when school buildings are used in public recreation centers. That's something that statute actually sets some guidelines on. And so we've kind of modified things to make it a little bit easier for those programs. We've reimagined staff qualifications and structure, and we'll get a little bit farther into that in a little bit. We've clarified and replaced supervisory ratio with supervision. The ratio was causing some confusion, so we've kind of clarified language and cleaned that up some. We've increased the number of children that may be in attendance by a little bit per staff member. We've reduced the total annual in-service hours for staff members, which is something we got a lot of feedback on through all of those engagement sessions that Melissa mentioned earlier. And then we've reduced regulatory burden, clarified and modernized throughout the regulations, and added a new regulation for programs that choose to serve preschool age children, trying to explore some new routes with this and open some space for better service for programs. And then throughout the drafted regulations, we merged the terms for children and youth to just children. It was a little clunky having both, and so we've kind of consolidated that. And then we've removed operator and just use applicant with a temporary permit and licensee to better reflect the way that regulations are written for the other programs we have. And then we've removed mobile summer programs. When we did the research on how many of these were active, there were none. And there had only been a handful of them ever in the history of that program being available. And so to kind of streamline the regulations, we've decided to remove that program. Moving on into the licensing application and processes regulations on the left side here, we have the current structure where there are 5 different regulations that each have different components of this process. And under the new structure, we've kind of consolidated that just into 577 and 578 and are revoking the other 3 regulations. So this way it can be much clearer and much more streamlined. So you've kind of got the one-stop shop. When you're trying to figure out how to apply, you can just go to these 2 regulations instead of having to sift through and maybe miss something because you're flipping back and forth or something. We're just trying to make it a little bit more user-friendly with the regulations. So I'll give just a couple moments for folks to kind of glance through that a little bit more thoroughly, because we didn't really change much about these. We did really just kind of restructure and clear them up.
So Lucas, if I can indulge just for a second, what I really appreciate was where Lucas used the term clean up. If you are a operator within the school age program, if you're a licensing specialist who's ever surveyed, you spend a lot of time cross-referencing regulations within our current set. And what I really appreciate is Lucas and Allison challenging us to make sure that we removed cross references and structuring the regulations in a way that are just easier, that provide ease when you're navigating through. And I think that was really what he is alluding to, is just we don't want to look for a pin in a haystack. We just really want to be able to have it to as much as you can have legal ease. We just really want it to be structured in a way that it is easier for the operator to just quickly find it. So I do appreciate the current structure and all of the layers, and then what we did with really trying to make it easier to just begin the process and understanding the application component.
They were absorbed into 577 and 588, Emily. We kind of restructured them and moved them into it. So they still have the content there. We still have the procedures. We still have the notification of non-compliance and things like that, but they got moved and reshuffled into the new regulations. So they're all in one spot instead of having to flip back and forth and cross-reference and kind of navigate multiple regulations. We can move on to the next slide, unless anyone else has other questions about this. All right. So moving on to public schools, accredited non-public schools, and public recreation centers. So as I kind of mentioned in passing earlier, Kansas statute 65-527 outlines kind of some guidelines for how these spaces, since they already have certain levels of certification and use approval, they get to have a little bit more of a streamlined process when they're offering the out-of-school time programs. And so we restructured some of the requirements for what they need to submit as part of their application to be more in line with that statutory guideline. And so in the new structure, they only need to submit the description of the program activities and services that are to be offered, the intended use of space and measurements for each room. If outdoor activities are conducted on the premises, we need that diagram, and then the background checks. And then something that is not on the PowerPoint that we actually added as part of our conversation yesterday was we also ask for a list of other programs and activities that might use the facility. So if you have a scout troop that comes in and uses the building or something like that, we just want to know how many programs are there. So that way we can kind of help keep the process streamlined so we don't accidentally have mix-ups where a child gets crossed from one program to the other or something like that. So that one's not on the PowerPoint, but we did add it yesterday. And then some key health and safety requirements were retained as part of this because we did eliminate some of the burdens, but we did keep the policy for restroom use when it's shared by non-program participants to help protect children. And then storage, handling, and disposal of hazardous items, which is a CCDF compliance issue. And then weapons and high-risk equipment protections and storage were also maintained. So we're really trying to keep these spaces safe, keep them available, but also follow in line with that guideline that comes from statute. We can move on to the next slide. And here's the fun one, staff qualifications and structure. So we have kind of reimagined the roles that were there. We have gotten rid of program director under the current regulation structure and moved to single or multi-site coordinators and site leaders. So the single or multi-site coordinator is able to oversee multiple programs. We got a lot of feedback that there are some facilities where their program director, they struggle to find enough program directors for all 5 facilities with the current qualifications. And we've set it up so that one person can oversee all 5 programs, but we still have it so that the site leader has to be on site at all times, and they're the person in charge in the authority chain for each facility. And then we've reduced the requirements for that site leader. And so these also sit in kind of a layered way where you can be the one for the level below you as well. So the single or multi-site coordinator can fill the role of site leader, and the site leader can fill the role of a group leader. And so they can kind of share double duty. This structure was something that kind of came out of a lot of the feedback again, and we really think that it's going to create a lot of positive shifts in the way that staffing is available, because you are able to kind of share, and you do have to have a site leader at all times. And so there will still be those protections there for making sure we know who's in charge of the program and who's overseeing the program. But the multi-site coordinator was really to give flexibility to larger programs. And if we go to the next slide, we have kind of the structure for how we've shifted some of those qualifications. Program directors used to be broken out into multiple categories. And a lot of the feedback we received is that the categories were kind of an outdated approach to this. And so we've condensed it down into just one set of qualifications. Where you still have to have the same skills and competencies that program directors had. You still have to have the age requirements and the degree requirements, but we've consolidated experience down. And in the same way that with the childcare centers and preschools regulation review, we've tried to create more of a balance between academic certification and months of experience. So there are 3 different qualifications. You can have the 12 credit hours or 6 months of experience, or a combination of 6 credit hours and 3 months of experience. And so we're trying to create more pathways for people to be employed in these positions by creating that balance between experience and academic training. We did also remove the requirement for an administrator. This became clear to us that many times the administrator was just a shared burden that was happening, and we think it's really more the business decision for an administrator. And so we removed that requirement from regulation, or allowing it at the discretion of the business model for programs. And then on the next slide, we have our new structure for the site leader, the group leader, and the assistant group leader. And the old structure had the group leader a requirement for experience, but it was not quantified. So there was no firm time frame. One day of experience would have worked because it just said you had experience. And so for the site leader, we gave an actual quantity of experience that you need with the 3 months of experience. And then we carried over the old group leader requirements for site leader. And then the new group leader requirements, we just got rid of the high school diploma or GED and then removed the experience as well. So we reduced the burden for group leader, but they would be under the supervision of that site leader or multi-site coordinator. And then assistant group leader, we left the requirements the same. So I'll give you kind of a moment to digest that. If there are any questions about qualifications, we can go ahead and take those now, but we'll also do some time for questions at the end if it takes time for people to kind of ruminate on it. I just know staff qualifications are kind of a big one, so I want to give space for that.
Would you be able to go back one slide? Thank you. I was still reading through it. Sorry.
And I think just to reiterate what Lucas had shared, what our department really tried to ensure is to move away from the similar language of a center, because it's a different, they're serving different children, and the structure there should be different than our new out of school or our out of school time settings. So I do appreciate Lucas's ability to make sure that we use language that felt more in line with the staffing patterns of our out of school time programs versus the expectation of in a childcare center or a preschool setting. So, and I think that's where we were getting stuck, is by continuing to use the same term in two programs, yet they really did mean something different. So this restructuring gives us an opportunity to just start fresh with a new definition mindset.
I have a question. Why are we removing high school diploma or GED for a group leader?
So part of that came from with the staffing struggles that the industry is facing. There were several programs that expressed that they would have, a 17-year-old who had graduated but didn't meet the 18-year-old requirement for the summer program because their birthday was like early August. And so they were at the end of the school year. So they had graduated, but they weren't the age requirement. Or on the flip side, they were going through one of like the vocational programs or things like that for some of the high schools where they get early childhood experience, but they were 18 and didn't have the diploma yet. And so we were trying to find a happy medium to kind of find a way that they could access that labor pool with the staffing issues that are happening. And we decided instead of reducing the age, we would remove the diploma, because the age we were pretty firm on just due to the ages of children in care. And while we would have liked to keep, I think, the most strict requirements we could have, we were trying to take into account the reality of just if we don't have the labor to staff the programs go away. And we're trying to help support the programs. And I think that's where a lot of it came from. Melissa, if there's other context you have for that, I think that would be, but that's what I remember from our conversations.
No, that was definitely from the regulated community, as the barrier with but remember, we did not remove the safeguard of a site leader always has to be on site. So you always will have somebody who is 18 years, has the GED, the skills and competencies, under that first bucket, always watching and overseeing the work of the group leader. That site leader may transition, may change. If it's different site leader in the morning versus the afternoon, if they're morning and after school or before and after school program, but they will always have that safeguard because of the requirement of the site leader. But you're right, Lucas, you hit it on. It's that. Did your mom decide to send you to school early, to kindergarten early, or did they decide to send you late? And then you're stuck in that, what does that look like your senior year, and really wanting to be able to support some of those students who are going into a different path, and still be able to work at the facility as a group leader. I think we can move on to the next topic, Lucas, and we can continue to get questions at the end.
And yes, Nicole, the site leader can act as a group leader, so they can serve in that both roles. They can work downwards. Next up is supervision and ratios. So the use of supervisory ratio and staffing requirements led to confusion and vagueness across the board. We've heard this from many of our engagement sessions, that there were different interpretations of what it meant. There were different applications of it happening. And so in order to clear up some of that confusion, we've moved away from the term supervisory ratio and now use supervision. And then we have the staffing requirements based on the number of children in attendance. So we have added a clear definition for supervision, being overseeing and guiding a child or children, knowing each child's location at all times and the nature of activities, being actively engaged with each child, and being in close proximity of each child to intervene if needed. And then the staffing requirements are for that every 36 children in attendance, there must be a group leader present. And for every 18 children in attendance, there must be an additional assistant group leader present. And so if you only have the 18 children, then you can just have one group leader and you're fine. But if you go over into that 19th child, then you have to have 2 adults present, or 2 of the leaders present. And those don't have to be all in the same space at the same time. This was the intent of the original regulation, but due to some of the confusion, this isn't how it was happening in practice. And so we're just trying to clarify that original intent. And so the example at the bottom is that there are 31 children in attendance. The site leader, who is serving as the group leader for this program, is in the gymnasium with 25 kids, while the assistant group leader is in the library with the other 6. That would be perfectly in compliance because they have those leaders present and they know where all the children are. There's an adult in proximity to intervene if needed. And so they are in care, they are supervised, they've just split the group for the activity, and that's okay because the group itself is those 31 children total. Moving on. We've also adjusted the annual professional development training, with the majority of out of school time staff not being employed year round or for multiple consecutive years. There have been a lot of different ways that the annual 16 clock hours have not been fully obtained each year. And part of that is due to the burden of the number of clock hours, and part of that is due to just the way that the staffing patterns work, where you're there for 3 months and then you're gone. In order to try to balance that and help bring back alignment with the foundational health and safety requirements, we've proposed doing the annual professional development training as an orientation each year, and that every staff member would have to go through. That shall be at least 6 hours in duration, and 4 of those 6 hours need to be in health and safety topics. CPR and first aid training and certification is not included in those 6 annual hours and is also still required. So it's an additional burden for the CPR and first aid training. But those 6 hours of orientation and the 4 of those 6 hours being health and safety is all the annual requirement now for the professional development training. And again, this was a reduction in that training in light of how the environment is different for out of school time programs compared to centers or preschools or daycare, home daycare settings, because the home child care settings and the centers and preschools deal with so much younger children that have less of that self-preservation instinct. And so we felt it was appropriate in the out of school time setting to reduce that burden, because you're frequently for smaller windows or you're dealing with older kids, and it's trying to make sure that that training is still happening, because in a lot of cases that we were finding out that there was a gap in where it was. And so we're trying to readjust for that.
Lucas, I believe Chelsea has her hand up. If we want to have Chelsea come off mute, we can,
Sorry,
and then we have Kelly. So we'll start with Chelsea first.
Can you hear me?
Yes.
Yes.
Okay.
so this is talking about annual professional development training. Is there any regulation related to like initial training? I'm wondering if this would lead a program to be offering the same orientation every year, and that repeat staff would maybe start to tune things out, if they're just trying to hit the basics for their new incoming staff. So I'm curious if there is any differentiation between this is your first time working in a school age program, so here's what you need, versus you're returning, so here's something that you need.
So, Chelsea, what we have learned through this process is the workforce within our out of school time programs is very different. Yes, you will have some staff that continue to return, but the vast majority, it's a turnover. It's looking at spending some time with our licensing specialists, trying to understand what that workforce looks like when they go do their hours. And it's a very small window of staff that are returning, just because of they're either summer camps or they're before and after school. So it's a very limited set of staff, because it's not that continuous full-time, because this particular group is at school.
Yep, that makes sense. I appreciate you framing that, because that was
so we wanted to make sure so I really wanted to give you guys some context in framing that. So when we did look at what are our regulations and what are the most common cited childcare practices within this, and it all stems back to really having that good foundational orientation training, which covers, now we've actually added a new burden to that, which is very specific to de-escalation, so that the program is really working on de-escalation for this particular group of children. And so, yes, it could be over and over again, but that's really based off of our deep dive into the workforce and frequently cited regulations and behavior management. That's where we felt like this needed to be reinforced. So appreciate that, Chelsea, for letting me indulge that, going a little bit down. And right now, Angela, the 6 hours of orientation, and then I'll get to you, Kelly, since I'm on that same vein. It's no different than right now. The school age programs get to create their own orientation training. So we're not going to change that, because we're not going to create a new barrier where the system's already creating that training themselves. Kelly?
The requirement for CPR and first aid, does that mean no one on site is required to have that? Or are there trainings different depending on their program, like their group leader, site leader, that sort of thing?
So current regulation states that you have to have somebody always available that has CPR first aid. Just in full transparency, we are out of compliance with our Office of Child Care requirements to have all staff have first aid CPR. So we're actually pivoting in a whole direction now, where you might have one program who's open in the after school, and you have one staff because that's their meeting regulation. Now we're going to require everybody to have CPR first aid. So it's if you are identified as a staff, you will have CPR first aid moving forward.
It just doesn't count towards your 6 hours of orientation.
Got it. That was the piece I was confused on. That makes sense.
Okay. Yeah. I apologize. I went in a whole different direction there. Angela, you have a question? Are your hands up?
Yeah, sorry, I was going back to the training. So if they get to create this themselves and 4 out of the 6 have to be health and safety topics, if it's my program and I feel out of the 4, I want to do basic child development, child abuse and neglect, or 2 other topics that's important to me, then that's what I can train on?
No, what we're saying, and we will make sure this is clear in the interpretive guide, you have to go over, you still have a laundry list of all of your health and safety topics, in which some of them are not really geared towards annual health and safety, which child development, behavior management are not continuous health and safety topics. So what we're just stating is that out of that 6-hour training, 4 of those hours have to be geared towards what we will define as the health and safety topics. But we've added on additional training, some additional training components within child development. And so again, that can be 30 minutes, but out of that full 6-hour content, 4 of them, you have to spend a minimum of 4 hours on health and safety topics. So within that list, you have emergency preparedness, you have biohazardness, you have, oh, and I'm just escaping me, you have supervision. So you're going to have, we will help narrow that down. We're just saying that to complement our state block grant and plan, that out of those training, because again, not all of those topic areas are health and safety, that out of those 6, that 4 hours must be spent on the health and safety topics.
And correct me if I am remembering correctly, that those 4 minimum hours are the CCDF requirement as well, correct?
Correct.
It is required for CCDF to have
Yeah.
the 4 hours in health and safety.
Yeah, that's part of our block grant, but they do still have the whole laundry list and they're still going to have to train on them. But we just wanted to be very clear that some of the training topics outlined in orientation are not actually health and safety topics. Like I would say almost 80% are health and safety topics. So we just want to make sure that they're not spending 4 hours on behavior management when really those 4 hours should make sure that they're covering the basic health and safety topics within that orientation list.
So we would still, this designated trainer would still need to take this KDHE approved training from like Casino or Child Care Aware or anything like that. How do we know what they're training on is appropriate, I guess?
Well, I guess I'm going to have you take a step back, and really that's not necessarily our role right now, because they can have this is very different even now than our current center outline of what we get, because this is not within health and safety training. This falls under orientation. So programs already have this flexibility now for us not to micromanage that process. And they are able to pull off online our the orientation checklist. They're able to sign it and date it that they've went over that, because this does not fall under training. This is under orientation. So it's already different now versus that. So if we are applying it that way, then please, we can talk offline, because the field should be providing some more flexibility because of the way the school age program regulations are written currently. Because again, orientation looks very different in other program types and health and safety than it does in our current school age programs. Chelsea?
So to clarify, I understand that they have flexibility with their orientation. And at this point, there is no additional training beyond orientation that's required. Is that correct?
Correct. But what we are doing is we're quantifying that, because right now there is no
Requirement around the orientation.
Around orientation. So we are giving them a new time frame. So theoretically, a facility could do orientation in 2 hours now, and we would accept that because there's no quantifier with that. So we are now adding an additional layer to it, in addition to all staff now needing first aid CPR. So theoretically, you can walk away possibly with almost up to 12 hours of training at the onset.
Would a program lead, site leader, I don't remember the name, is there an option for them to seek out, like, could their staff take health and safety training through Casino, for example, and that it fill this quote orientation requirement? Or does this have to be provided in-house? What would that, what I'm thinking about is, does this place a burden on a director to now have to when maybe there's already content out there and available that they would like their staff to go get, can that merge with this can it help meet this requirement, or would that be on top of this, or how might that pan out?
That's really up to the program, Chelsea, to make those decisions, because they're onboarding staff more. When you think about our outdoor summer camps, they're onboarding staff in a really fast-paced manner to open up their camps in the summer. So this may not actually taking the modules through CCSIT may not be to their benefit. So this just gives the program the flexibility to provide it on site, to provide it in a different way, because remember, this is not under training. This has always been under orientation. So very different feel from the very beginning of when we did reauthorization in 2017. This is not, there's no reference to health and safety. This is all about orientation. So really trying to keep that very clear. Like, these programs already are doing this themselves now. We're just giving a quantifier to it. So Chelsea, I guess I would ask CCSIT to see, let's look into your data and see how many programs are currently utilizing the CCSIT initial modules to meet their orientation. And if not, is there a different way that we can engage that staff that are serving school age children through these programs? Because again, they have that option now.
Thanks for clarifying that, Melissa. And
Yeah.
I don't know, but I think you're right that would be great information to look at.
Hey, thank you. Lucas, I'll let you move to the next slide.
All right. And then we have kind of broadly reduced some burdens and removed some barriers. This is definitely a big focus of the regulation review, both this one and the one that we've completed that's with the Attorney General's office. So we kind of have a laundry list here of some of the burdens we've removed. We lowered the age to 18 for an applicant from 21 to be in alignment with other program types. We've streamlined staff records to include a record of education and experience, training record, and a health status form. We've streamlined children's records to list the minimum items that shall be on file for each child. And we are drafting an all-encompassing enrollment form that may be used, or any alternative form that the program develops themselves that meets those minimum requirements that are listed. This is to kind of make it so that it's a one-stop shop for your form, to have the emergency contact information, medical history for like any allergens or things like that that the program needs to be aware of. And then we've exempted outdoor-based programs from all building requirements when a building or shelter is used. This is because when the original regulation was drafted and promulgated, shelter houses weren't quite as fancy as they are anymore. And nowadays, I mean, you go to shelter houses at the lake or something like that, and they're pretty robust buildings, even if they aren't quite what we would expect for a nice stay or something like that. So we kind of removed those requirements. So even though it is enclosed on all four sides, we still treat it as a shelter in an outdoor-based program. We removed the impact absorbent surfacing material chart. The chart was kind of complex and over-regulating, so we still have the burden there that you have to have impact absorbent surfacing material, but we don't get down into the weeds of exactly how much at which height and things like that. We just require that you have it. We simplified regulations for programs serving children with special healthcare needs. We removed many of those requirements and have structured it essentially to the point where we are ADA compliant and say that you must make the reasonable accommodations based on the situation. A lot of the language that was there was determined to be kind of otherizing or outdated. And so we've really tried to make it so that it's much more of an inclusive, tailor it to the child situation. And then we've clarified and simplified requirements for the use of physical restraint and added de-escalation methods to orientation. This was something we received a few points of feedback on, where Many programs were asking for kind of a more straightforward guide to physical restraint. They felt that even those who were certified sometimes felt like they weren't able to use it because the regulation was unclear. So we've tried to clarify the situations where that is appropriate. And then we removed the amendment fee for programs when they are amending their license. And yeah, that's all our barriers. So moving on to the next slide, unless people want to take a moment with that. No, okay. Out of school time programs may now serve preschool age children only if the following requirements are met as well. This is kind of our big, we're doing a little bit of an experiment here. The out of school time program has to be located in a public or accredited non-public school that offers preschool as part of the curriculum. The child attends the same school that the out of school time program is located at. The period of care is during the school year before and after school, not exceeding 4 consecutive hours. There is a staff child ratio of 1 to 12 for preschool age children, and that's for the whole group. If preschool age children are in attendance, as soon as you have one, you have to meet this stricter staffing ratio. And then direct visual supervision must be provided at all times for the preschool age kids. And we did exempt these children from certain activities, such as self-administration of medication and high-risk activities, because what we're really trying to do here is say, if your child goes to preschool during the day at the school, they can go to the after school program until pickup, or they can go to the before school program right before school. And they don't have to go to, a home-based facility or a child care center and then travel to the school to go to the preschool and then travel back to the home-based facility or the center for after school until the parent is off. We're trying to reduce that shuttling of the child back and forth and just let them stay at the same program at the same location. So it's not super wide. It's still not letting the preschool children go to summer camps. It's not letting them participate in archery or taking their own medication or anything. It's really kind of narrowly constructed to be you're at the same school and you have stricter burdens to take care of them. This was something that several of the programs requested, and we're being very cautious as we implement it because we realize it is a new thing. We have looked around at several other states, and there are some states that do have programs kind of similar to this. And so we did kind of model after those. But it's something that we are excited to see how it benefits programs and benefits children by rolling this out.
And I really wanted to share, if we can go back to that last screen, Megan, that there are guardrails with this. So you will see just the before and after school. And again, we changed our language from to the direct supervision, and really wanted to just let everybody know that this is at the behest of the regulated community to really serve families. And we're wanting to, these were not like conversations as we move through what this would look like. And if you're curious of other states, you can look at our partners south of us. Oklahoma has carved out regulations for this age group, and so we're meeting regional needs too with families. So especially on our communities that are close to the border, and really trying to do something that again supports families. We can go to the next slide, Megan. Thanks.
And then we did have 2 questions kind of for you that we wanted to just check with. First, with outdoor programs, we wanted to know if we are a barrier in limiting them to operate only during the summer months. We heard a very small amount of feedback that some of these programs might have interest in operating during spring or fall break or winter break. And we just aren't sure if that's something that's actually desired, if that's actually a barrier or not. So if anyone has feedback on that, we would love to hear it. And then the second one is if there is an alternative name you can think of for drop-in programs. We have not really touched these regulations as part of our review, but we wanted to make sure people were comfortable with the name, or if there was an alternative name that people wanted to use, we are welcoming feedback on that. So either of those, fair game.
From a parent perspective, I think, including fall and spring is very helpful. I've noticed some communities offering, like a local theater group offering a break or offering classes during a break or things like that. My daughter attends a private school and they sometimes cover pieces of the break as well. So I would say, why wouldn't you? I mean, parents want their kids outside as much as possible. So I think that would be fantastic.
I agree, and I think we also see a lot of childcare providers, the family home providers take their vacations during those times, and so parents are looking for alternate care during those high kind of peak seasons.
That's a good point. I hadn't thought about providers taking vacations during this time. All right. Hearing nothing else, we can go on to the last slide, which is we do have this QR code in this link, and I'm going to really quickly copy that link into the chat. We are doing yet another survey. So if you have any feedback that comes to you after this session is over that you would like to provide, this is the link where you can do so. We are still working on getting these regulations just finalized up. Yeah, Angela, I've had that thought myself too, and I just haven't mentioned it to anybody, but I do think that OOST is kind of weird and just OST is probably better. So yeah, we will take that back to the team.
And it rolls off the tongue so much better. If you can't tell, I've been struggling with the out of school time. So, and thinking OST, I like that. It feels very, very new.
Yeah. But yeah, so we've got that. And thank you all for being here. I guess we can open it up for any final questions. I think that's what the next slide is. And if you have any questions, any comments about anything that we went over, I know I kind of talk quickly, and so I just kind of spewed a whole bunch at you, and it might take a moment to process some of it. But if there's anything else that people would like to have.
I just really appreciate everybody joining and really use your QR code. I know licensing specialists had been given that already, and hopefully they have been provided an opportunity to share information. But our goal is to have these regulations, because we've already had stakeholder engagement, and Lucas is capturing feedback. But our goal is to have this set of regulations out of the department sooner than later, to go through the promulgation process. As we've shared at you're probably tired of hearing this. The next step is Department of Administration after we do our own internal review and concurrence, and then to the Attorney General's office. And we already have 2 sets of regulations for homes and our centers and preschools at the Attorney General's office. So it'd be nice to just keep these moving forward, so the department can keep moving in a very proactive engagement with the regulated community. And so again, please don't think about this, oh, I'll wait and do this until in 2024, because by then that might be too late to provide feedback. So we're giving you 30 minutes back of our CCSIT team. So if you have any feedback you want to give now, please use that right now, so your comments and your feedback is not lost. All right. Well, we appreciate you guys joining us. And have a good next and safe couple of weeks.